First tonight, though, the spotlight on student mental health is growing. Iredell-Statesville Schools is preparing to receive more than $17 million in federal funding to help further their resources on this front.
And we've learned the need is certainly there. Just in the last month, the school district reports receiving 20 crisis calls. Those involve an emergency situation where a child is in immediate danger of seriously hurting themselves or someone else.
WCNC Charlotte's Brianna Harper shares how the district's use of more mental health services could lessen these emotional struggles.
Iredell-Statesville Schools is no stranger to improving student mental health. For the past 4 years, the district says that's been the mission. And now they're getting some extra help in the form of a $17 million federal grant over the next 5 years.
I think the federal government, when they look at us, say, these guys are well poised to do good things with these funds.
Right now, the district only has 10 therapists that serve more than 170 students in the school-based mental health program. On top of that, there's a growing wait list.
There's definitely a need, and we're hoping that with 22, we can really, take a bite at that need that we've seen and get those wait lists down.
The grant will work to provide 22 clinicians and also the chance to develop more meaningful relationships.
We've built into this grant that they'll have once a month family sessions so that work that the kids are doing in therapy with a school-based clinician transfers to home, and that we can support the families as well.
School leaders say the goal of the project is to lower anxiety and violence in students and also improve emotional management.
Something that we wrote into this grant was a crisis worker and having like a crisis line. Like we literally wrote in a cell phone that anyone can call. And our expectation is within 1 hour, a clinician will be on a school campus to help assess that student and make sure that it's safe.
The district says they are already beginning to hire for these positions and working to implement these resources just as soon as possible. Brianna Harper, WCNC, Charlotte.